Most of the time, the inflammatory and immune responses are helpful for protection against infection and cancer development. However, when inflammation or immune response are prolonged or excessive or occur at inappropriate times, normal tissues are damaged. These responses are overreactions to invaders and foreign antigens and are known as hypersensitivity or allergic responses. When these responses fail to recognize and protect self cells, normal body tissues are attacked and harmed. This type of reaction is known as an autoimmune response. After this lesson, you will be able to recognize the importance of hypersensitivities of each patient that are documented in medical records and communicated with the healthcare team. Implement measures to prevent anaphylaxis. Encourage all patients with a severe allergy or history of anaphylaxis to wear a medical alert bracelet or other identification. Describe allergy testing techniques. And to identify the manifestations of hypersensitivity reactions. Okay, let's discuss hypersensitivity. First, let's talk about hypersensitivity and autoimmunity. When inflammation or immune responses are prolonged or excessive or occur at an inappropriate time, normal tissue is damaged. It is also the process when response to fail to recognize and protect own self cells, and then normal body tissues are attacked and harmed. Hypersensitivity is an increased or excessive response to the presence of an antigen to which the patient has been previously exposed. A wide range may occur from watery, itchy eyes to life-threatening anaphylaxis. There are 5 types of hypersensitivity depending on timing, pathophysiology, and clinical manifestations. So let's discuss the mechanisms and types of hypersensitivity. We have type 1, immunoglobulin E mediated reactions. Type 2, tissue-specific reactions. Type 3, immune complex mediated reactions. Type 4, cell-mediated reactions. This is more of a delayed reaction. Then we have type 5, stimulatory reactions. We will discuss each type in detail. Okay, so type 1, immunoglobulin E mediated reactions. Atopic or rapid hypersensitivity. It is the most common type, also called atopic allergy. The individual is genetically predisposed and called atopic. It results from an increased production of immunoglobulin E antibodies. Examples are anaphylaxis and allergic asthma, hay fever, allergic rhinitis, and allergies to specific allergens such as latex, bee venom, peanuts, iodine, shellfish, and drugs. Allergens can be contacted by inhalation, ingestion, injection, and contact. Reactions may be local or systemic. Immunoglobulin E mediated reactions. Process involves histamine acting to cause contraction of the bronchial smooth muscles, causing bronchial constriction, increasing the vascular permeability, causing edema, and causing vasodilation, increasing the blood flow to the affected areas. Manifestations of type 1 reactions are largely attributed to the effects of histamine. Systemic reactions include involvement of all blood vessels and bronchiolar smooth muscle, causing widespread blood vessel dilation, decreased cardiac output, and bronchoconstriction, which is known as anaphylaxis. This can be fatal. The first feelings a person will experience are uneasiness, apprehension, weakness, and impending doom. Then they may have pruritus and urticaria. Okay, so now we're going to discuss anaphylaxis. Okay, so let's discuss anaphylaxis. The patient can have erythema and sometimes angioedema of the eyes, lips, or tongue. You want to first assess the respiratory function, make sure there's an airway established. CPR may be needed. They may need epinephrine, antihistamines, or oxygen. Some examples of agents that can cause anaphylaxis are shellfish, eggs, nuts, berries, latex, and/or bees. You want to teach the patient to wear an alert bracelet. They may need an EpiPen. You want to make sure that they know how to administer the EpiPen. You want to make sure that they're aware of cross allergies like penicillins with cephalosporins, bananas, avocados, and nuts to latex. You want to call the rapid response team if you have one. Make sure you establish an airway, stop any drug infusions if it's a drug anaphylaxis reaction, but maintain the IV line. They're going to need epinephrine, and for bronchospasms, theophylline may be given, and then nebulizer treatments may also be added. Okay, so now we're going to discuss hay fever. It is allergic rhinitis. It's triggered by reactions to airborne allergens such as plant pollens, molds, dust, animal dander, wool, food, and air pollutants. Some are seasonal, meaning that they occur at the same time of the year. One first exposure to an allergen, the person responds by making antigen-specific immunoglobulin E. This antigen-specific immunoglobulin E binds to the surface of the basophils and mast cells. These cells contain granules of vasoactive amines, also known as histamine. Other proteins are released, such as leukotrienes and prostaglandins. Hereditarily, the tendency is to produce immunoglobulin E in response to antigen exposure, and is based on genetic inheritance. There is no single gene responsible. Specific allergies are not inherited, just allergic tendencies. About 50% of patients with allergic rhinitis have one parent with type 1 allergies. So lab work can be done, such as an allergic response is validated by an increased eosinophil count. It might be as high as 12%. Serum globulin E level will be elevated, and then there could be allergy testing. Allergy testing can be done as a scratch test or intradermal testing. Antihistamines are discontinued for at least 5 days prior to the test, and then serious reactions to scratch testing are rare, but ensure that emergency equipment is available just in case. Interventions is to include avoidance therapy, drug therapy, complementary and alternative therapies, and desensitization therapy. Environmental changes may need to be made. Airborne allergens can be reduced by air conditioning, air cleaning units, and removing cloth drapes, carpet, and upholstered furniture. And you want to cover mattress and pillows to decrease dust mite exposure, and then launder the bed linens weekly in hot water. Now we're going to discuss some drug therapy. We have decongestants that work by causing vasoconstriction in the inflamed tissue, thereby reducing the edema. We have the antihistamines that block the histamine from binding to receptors, and it prevents vasodilation and capillary leak. Corticosteroids prevent the synthesis of mediators. Mast cell stabilizing drugs prevent mast cell membranes from opening when an allergen binds to the immunoglobulin E. Then we have the leukotriene antagonist, and it prevents leukotriene synthesis. And then let's talk about desensitization. The allergy shots may be needed when allergens cannot be avoided. Subcutaneous injections of small amount of the allergen, and increasing doses given weekly. Then spacing intervals are increased in the following years. The theory is the allergen binds to the immunoglobulin G, which removes the allergen from the body by precipitation. Allergic responses are decreased by competition. Okay, so let's discuss type 2 tissue-specific reactions. The body makes special autoantibodies directed against self cells that have some form of foreign protein attached to them. Examples are hemolytic anemias, thrombocytopenic purpura, hemolytic transfusion reactions, Goodpasture syndrome, and drug-induced hemolytic anemia. If applicable, you want to stop the offending drug or blood product. HLA antigens or tissue-specific antigens may be the cause. Autoimmune thrombocytopenia purpura. The platelets have groups of self-antigens found on no other tissue in the body. ITP is a result of when the body attacks self-antigens on the platelets. Type 3 immune complex mediated reactions. Excess antigens cause immune complexes to form in the blood. These complexes lodge in small blood vessels of the kidney, skin, joints, and small blood vessels. Deposited complexes trigger inflammation, resulting in tissue or vessel damage. Autoimmune diseases are examples such as RA, SLE, serum sickness. These are not organ specific. These deposits activate the complement cascade, generating chemotactic fragments that attract neutrophils into the inflammatory site. Unfortunately, the neutrophils have a hard time with phagocytosis of these complexes and release lysosomes that destroy the tissues. Okay, so now we're going to discuss type 4 cell-mediated reactions. This is more of a delayed reaction. The first three types of reactions are mediated by antibody. Type 4 is not. It is mediated by specifically sensitized T lymphocytes. The reactive cell is the T lymphocyte. They release chemical mediators and triggering macrophages to destroy antigens. It typically occurs hours to days after exposure, and antibodies and complement are not involved. Clinical manifestations include local edema, induration, ischemia, and tissue damage. Some examples include contact dermatitis, poison ivy, skin rashes, local response to insect stings, and tissue transplant rejection. One common example would be latex allergy. It could be type 1 or type 4 reaction. The incidence of latex allergy is increasing. People at the highest risk are patients with spina bifida, people who routinely use latex condoms, and healthcare workers who use latex gloves. Okay, now we're going to discuss type 5, which is a stimulatory reaction. It involves excessive stimulation of a normal cell surface receptor by an autoantibody, resulting in a continuous turn-on switch state for the cell. An example is Graves' disease, and treatment is usually done with surgical removal of the cells or destroyed cells with radiation. Okay, so I'm going to discuss a couple of autoimmune disorders with you. We have Sjogren's syndrome. It often appears with other autoimmune disorders. Problems include dry eyes, dry mucous membranes of the nose, mouth, and vagina, caused by destruction of lacrimal and salivary and vaginal mucus producing glands. Virus may be the trigger. You want to check the lymph nodes and suppress inflammatory response. Then we also have Goodpasture syndrome. This is an autoimmune disorder in which autoantibodies are made against the glomerular basement membrane and neutrophils. Lungs and kidneys are harmed the most, with the lungs having hemorrhage and rapid development of glomerular nephritis with renal failure. Most often occurs in young men. Treatment is high dose of steroids and/or plasmapheresis, and then dialysis may also be needed. This concludes this lesson of immune function excess. If you have any questions related to this lesson content, contact the instructor.